This video presentation was created as a public service announcement for speech-sound disorder. You might wonder, what is speech-sound disorder? Records show that speech-sound disorder, formerly known as phonological disorder, has been around since at least the 1970s. This disorder involves children and sometimes even adults who continue to make phonological mistakes after the age of 8. There are two forms of speech-sound disorder. Someone can have articulation disorder, phonological disorder, or perhaps even both. Articulation disorders may involve dropping, adding, distorting, and even substituting other sounds, while phonological process deals with the sound patterns. The criteria to diagnose a child with speech-sound disorder include: a child must show persistent, unintelligible speech consistent of addition, omission, distortion, or substitution. There is interference with social participation, academic performance, occupational performance, or perhaps any combination thereof. The onset of symptoms is during childhood, and the symptoms cannot be accounted for by another medical or neurological condition, including traumatic brain injury. Often enough, some children simply do not learn how to speak correctly. In other instances, physical problems can contribute to the disorder as well. A child may have been born with cleft lip or cleft palate, which would not allow the child to pronounce letters correctly. Some children even have autism or Down syndrome, which also creates speech impediments. The most common form of treatment for speech-sound disorder is speech-language therapy. While meeting with a speech therapist, he or she will work with the children to help them recognize and correct the sounds they cannot say, learn how to correctly produce speech sounds, practice saying certain words and sentences to speak more clearly, and the children will even practice at home with activities and strategies learned in therapy. In the event that the disorder is caused by physical problems such as cleft lip or cleft palate, the child would undergo surgery. During a cleft lip surgery, the surgeon will trim the tissues and sew the lip together. For a cleft palate surgery, plastic surgeons connect the muscles of the soft palate and rearrange the tissues to close the cleft. Typically, these surgeries are very successful, and the cleft lip or cleft palate are repaired, leaving barely noticeable scars. A new treatment being studied is called speech-oral-motor treatment. During this process, the idea is to stimulate or improve speech production and treat children with specific speech errors without requiring that the children produce a speech sound. This method of therapy uses exercises such as smiling, blowing kisses, blowing horns, and blowing bubbles, and performing lip massages to target lip mobility for the production of speech sounds involving the lips, such as letters like P, B, and M. By working the movements of the mouth and lips, it can be like an exercise teaching the children how to use those motor skills. It also might help the children because they do not have to actually speak in therapy, which could cause embarrassment for them. The treatment is still being researched, but studies have shown that this process can improve speech in children. Many children and even some adults simply do not outgrow speech mistakes as most people do. Some mistakes children may make are adding or dropping sounds and/or syllables. Children making these mistakes may be adorable for a little while, but by the age of 8, a child should have learned to correct those mistakes. Depending on what causes the disorder, it is typically an easy fix with speech therapy. If the cause of the disorder is a physical issue, such as cleft lip or palate, a surgery may be needed. Speech-sound disorder is not uncommon. In fact, it has been around since the 1970s and probably will continue to occur.